Hi, my name is Dr. Sameer Gupta. I'm a senior interventional cardiologist and the director of the cardiac cath lab for the Metro Group of Hospitals. So heart disease has become an epidemic in India. Actually, it's across the world as well. They say about 25% of all people across the world die of cardiovascular diseases. Now, even in India, the number of heart disease is increasing, the number of patients who are coming with heart disease is increasing, and there are many reasons for this. But now let's look at the risk factor profile that causes heart disease. There are some major risk factors like diabetes. India is the diabetes capital of the world. The number of diabetics and pre-diabetics in India are more than anywhere else in the world. Hypertension, which is high blood pressure. We're seeing a lot of patients, even young people, sometimes in the 20s and 30s, coming up with high blood pressure, and that's because of the lifestyle that they lead, the high stress environment they live in. Smoking is a very big risk factor. The number of people who are smoking in India has increased dramatically over the last few years. That includes both tobacco smoke from tobacco smoking as well as chewing tobacco, what you call Gupta. That's also increasing. High cholesterol is a very big risk factor. We're all eating a lot of Western diet, a lot of fried food, a lot of fatty food, and that increases cholesterol among other things. Family history is a very big risk factor. Those patients who have there's somebody in their family who's had heart disease or strokes are at a higher risk of having cardiovascular diseases as well. There are some other risk factors we don't often appreciate, like a high stress environment. High stress increases blood pressure. It can lead to plaque rupture that can precipitate heart attack and heart diseases. Lack of sleep, physical immobility where you're not moving around too much, not exercising regularly, that increases the risk of heart disease. And another risk factor is pollution. I live in Delhi, and in India, multiple studies have come out that have shown that India has some of the most polluted cities in the world, and this is also a risk factor for heart disease. One of the best things that you can do for your health is quit tobacco. Tobacco in any form, whether it is smokeless tobacco, like in one of the best things that you can do for your health is quit tobacco in any form. Whether it is chewing tobacco, whether it is smokeless tobacco in the form of, one of the best things that you can do for your health is quit tobacco in any form you may be consuming, whether it is in bidi, hookah, cigarette, or even smokeless tobacco in the form of gutka, for example. This is the single best thing that you can do for your cardiovascular health, for your overall health, and improving your quality and actually quantity of life, living longer, is quitting tobacco. Tobacco is very harmful for you. When you smoke tobacco or when you chew tobacco, the tobacco goes into your body and it increases your blood pressure. It causes vasoconstriction. It increases your blood pressure. It can increase your risk of cancer. This can further cause a whole host of problems. So quitting tobacco is the single best thing that you can do to improve both the quality and the longevity of your life. A lot of my patients smoke, and when I was back in the US, a lot of my patients even did drugs. They would come and tell me that, Dr. Gupta, it's easy for me to leave drugs, but quitting smoking has been one of the toughest things that I have done. So quitting smoking, I understand, is very difficult. However, it is not impossible. There are various strategies that you can use to quit smoking. The first and foremost thing you have to do is decide you want to quit smoking. You have to be sure you want to quit smoking. That's one of the most important things to do, is make up your mind and have a good mental makeup. After that, there are various different strategies. There are counseling sessions available that can be used. You can use various nicotine replacement therapies, whether it is in the form of gums, patches, sometimes even lozenges. These are effective as nicotine replacement therapies, and you can slowly wean them off. Some of my patients even use medicines. There are prescription medicines available which you can use to quit tobacco and wean yourself slowly off it, and in a few weeks you're good to go. So there are various different strategies that can be employed, that should be employed in quitting smoking if you're not able to leave it cold turkey. But it's also very important to create awareness about these therapies, to create awareness in the public that these therapies do exist and you can get off tobacco. tobacco, and you, first of all, like I said, you have to make up your mind that you want to quit tobacco and smoking. You know, my patients sometimes in their 40s and 50s, you know, there was a time, you know, heart disease has become an epidemic, and it's actually affecting all age groups. Sometimes people in the 20s, 30s, 40s are also getting heart disease and heart attacks. Previously, when we would go back and think of heart disease, you would primarily think of people in the 60s, 70s getting heart disease, but that demographic has slowly and steadily changed to more younger people also being affected with heart disease. Now, the thing is that when you get a heart attack or when you have a problem, it is not something that happened in the last 24 or 48 hours. It is years and years of insults to your body that has led to the reason why you're having a heart attack at whatever age that is. So it's important to take care of your heart even when you are young, even when you're healthy, so you can reduce the risk of having heart disease and heart attacks later in your life. So some of the simple things that you can do is just lead a good, healthy lifestyle. What I mean when I say this is have good quality food, a food which is good in vegetables, which has high content of vegetables, fruits, try and reduce the consumption of alcohol, don't smoke, exercise regularly. It's actually recommended that you should do at least moderate intensity exercise for 30 minutes a day for 5 days a week. So it's about 150 minutes a week. And I'm pretty sure, irrespective of how busy you are, you can take out at least 2.5 hours a week for your own health. Get good quality sleep. Sleep for 7 to 8 hours. When you sleep, your body relaxes, your heart relaxes, your steroid level in the body comes down. So good sleep is essential for good heart health as well. You know, just these simple things will really improve the quality of your life and will significantly have an impact on reducing your risk of heart disease later. Some risk factors for heart disease. Some of the major risk factors is diabetes, which is high sugar in your body, hypertension, which is high blood pressure in your body, high cholesterol, which is high cholesterol in your body, high lipids in your body. There are some other risk factors like family history and smoking, but these are 3 very important risk factors in your body. And the thing is that you may have these risk factors and not even know about it. They are very much asymptomatic in most people. People don't know that they have diabetes unless it's sometimes you have a complication and then you figure out you have diabetes. You can have hypertension for a long time, high blood pressure for a long time, and not really have any symptoms along with it. And the same thing goes for high cholesterol as well. So it's important that when you're above the age of 30, 35, just go get a screening test done. Just get your cholesterol checked, get your diabetes checked, get your blood pressure checked, see where you are, see where you stand. Just a one-time thing, just to make sure you're okay. And if your numbers are off, then start taking care. Try and rectify those things, because if not treated, the disease is going to happen. It's just a matter of time. So it's very important to get yourself tested. Now, many of my patients have even asked me that, doctor, I want to start exercising. Is this something I should do? Well, it depends upon what your physical status is, what your risk factor profile is, how active you've been, what activity are you looking for. So it's very important that you go to a doctor, get yourself tested if needed, and he'll guide you as to how you can start your physical activity and what you should do and what you should not do. Also, if you are working out, if you are exercising, then please listen to your body. See what it is saying. Are you having any chest discomfort? Are you getting short of breath? Are you getting dizzy, lightheaded? Are you passing out? Do you feel more fatigued than you think you should when you're exercising? So these are some of the very important things to look for when you're working out and exercising, because they may be red-herring, they may be warning signs for future cardiac events. So get yourself tested, talk to your doctor. Check for cholesterol, diabetes as and when needed, especially if you have a family history or if you're above the age of 30, 35, somewhere in that range. And also, if you are working out, then please listen to your body and try and do it in a supervised manner. Don't try and overexceed than what you can do, because that is also harmful. So, but exercise is very good for you overall, and it will significantly improve the quality and longevity of your life. Well, the answer is very simple. Have a good, wholesome, nutritious diet. What I mean when I say this is have a diet which is rich in fruits, vegetables, whole grains, low quantity of oil, low quantity of ghee, low quantity of butter, a low quantity of hydrogenated fats like dalda. So, just have a good, wholesome, nutritious diet. If you look at the diet that most of us in India eat, chapati is a staple form of our food, so is rice, and then there is a dal. But when you look at actual vegetable content consumption, it's not very robust. It's not a very high quantity of green leafy vegetables or nutritious food. It's a lot of India has a very high carbohydrate diet. So it's important to have wholesome food with a good quantity of vegetables, fruits, and other healthy things.